Bismillahirrahmanirrahim. Today we will talk about the negative effects of caffeine on fertility. When either men or women drink 3 or more cups a day of caffeinated drinks before pregnancy, the woman is nearly twice as likely to lose that pregnancy early on. And if women consume more caffeine after they conceived, they were more likely to miscarry. It was stated in NBC News. Caffeine poses difficulty for women to conceive. Researchers show that there is no clear proof that caffeine affects the ability to become pregnant, but some studies have found that women who drink large amount of caffeine may take longer to become pregnant. Coffee, soda, and tea all have one thing in common: they all have caffeine. Caffeine has been linked with infertility and early miscarriage. But not all studies agree on this fact. Part of the problems with these studies is that they rely on people accurately reporting how much caffeine they consume. People are always not honest about the use of the things like coffee, green tea, and Red Bull, etc. They don't know exactly how much is the amount of caffeine per cup, and they may not just realize how much they consume. Researchers did study on large number of the women, and instead of asking how much caffeine they consumed, they measured the amount of caffeine and caffeine metabolites detected in their blood. A pregnancy was confirmed if a woman had a positive blood pregnancy test. An early miscarriage diagnosis was made if a pregnancy was lost before it was seen on ultrasound scan. Later miscarriages are those which occurred after being seen on the ultrasound scan. The results of the different studies done on caffeine are really pretty amazing. Women who had any level of detectable caffeine in their blood prior to conception had almost five-fold greater risk of an early miscarriage. There is very little impact of caffeine on early or later miscarriage, except that coffee exerted a greater risk for the later miscarriage. Soda, on the other hand, exerted a greater risk for early miscarriage. So, the simple advice by the fertility specialist is to avoid caffeine if someone is trying to conceive. Now, about caffeine, the question which is commonly asked by the people is that will caffeine use make it take longer to conceive? To get the most accurate answer, we looked at different studies in which the researchers assessed the caffeine use by doing blood testing rather than by just asking people whether they consume caffeine or not. Why is it so? The answer is that some people may not report consuming caffeine even when they do. For example, many people may not realize that chocolate or tea contains caffeine. Caffeine amount in each cup of coffee is also not fixed and measured universally. When someone says she took 2 cups of coffee, then what does that mean? How big is the cup? Is it cappuccino or straight coffee? No idea about that. So, blood testing allows us to determine accurately how much caffeine is in a specific person's body. Now, coming back to our previous question, will caffeine use make it take longer to conceive? When different studies were done by assessing the caffeine levels by doing the different blood tests, those women who had high level of the caffeine in their blood took longer to become pregnant and had higher risk of miscarriage. So, looking at the effects of caffeine on fertility, the advice which is given to the woman trying to conceive would be, first of all, to limit the caffeine intake. Secondly, eat healthy diet, maintain a healthy weight, reduce stress, and get enough sleep. Now, if a woman is trying to conceive, how much caffeine can she take? Different studies recommend under 200 milligram of caffeine per day. That would be safe for her. So thank you so much. That was all about the effect of caffeine on fertility. Subscribe on Obs and Gynae. Thank you so much. Allah Hafiz.